Hey everyone, welcome back to all my listeners. This is episode number 8 of season 9. Today is Wednesday, June 21st, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, just a friendly reminder, please go ahead and start following this podcast on Spotify, because just a couple months ago, Anchor became Spotify for podcasters. So I'd really love your continued support of my content-rich, value-add podcast on Spotify, where I know you can find Paint the Medical Picture podcast. It's right there available, just like it is on so many other platforms. I just know that so many of you in the age bracket of 25 to 45, my highest listener categories, I know all of you do create your own music playlists on Spotify. So it's super easy to find me on the podcast section of Spotify as well. So I've gone ahead and provided a link in my show notes for you guys to use and show your loyal support of my Paint the Medical Picture podcast on Spotify as well. Now, all right, you guys, I really do hope all the dads out there had an incredible Father's Day on Sunday, relaxing, playing sports, watching sports, fishing, hiking, biking, whatever it is you guys wanted to do, right? And I definitely hope you got some tasty dinner, some tasty brunch, and some drinks as well. Now, I know so many of you have reached out to me, and you noticed that last week's session was a bit wonky, right? Because usually the second episode each and every month is dedicated to the OIG Work Plan, but that was delayed last week because there was a huge hiccup in the audio segments that I was recording in Spotify last week. So I thought it best to go ahead and delay until this week so I could go ahead and use the recordings that finally populated in Spotify for me to use. So I do apologize for the slight rearrangement in the month podcasts. Now, anyways, you guys, so today's Newsworthy is going to go ahead and take a peek at that May 2023 OIG Work Plan, right? Which was supposed to be issued last week, but it got a bit confused because of my audio segments. So I apologize. Today, I will be taking a peek into the May 2023 OIG Work Plan. And of course, in my compliance tips and my compliance recommendations today in Trusty Tip, I go ahead and get into the brand new modifiers, JK and JL. What on earth are those modifiers used for, right? So we have more modifiers to add to our ever-growing list of modifiers. And of course, I go ahead and close out and round out today's episode in Spark with a remarkable quote on success by Salvador Dalí. If you guys have checked me out on LinkedIn, you know I'm all about compliance and trying to protect our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help all your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts, and definitely start following this podcast on Spotify or wherever you listen to my podcast. I'd really, really love your continued support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced coding services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy, the month of May's OIG Work Plan updates. There are 6 updates to the OIG Work Plan for the month of May. The first OIG Work Plan is titled Superfund Financial Activities at the National Institute of Environmental Health Sciences. Now, this report is coming from the Office of Audit Services. The National Institutes of Health's National Institute of Environmental Health Sciences, the NIEHS, provides Superfund Research Program funds for university-based multidisciplinary research on human health and environmental issues related to hazardous substances. Federal law and regulations require that OIG conduct an annual audit of the Institute's Superfund activities. The OIG will review payments, obligations, reimbursements, and other uses of Superfund money by the NIEHS. This final report is expected in fiscal year 2024. Now, the second OIG Work Plan update for May 2023 is titled Audits of American Rescue Plan Act of 2021 Funding for the Child Care and Development Fund. Now, this report is expected to be coming from the Office of Audit Services. The Child Care and Development Fund, the CCDF, is a federal and state partnership program that provides financial assistance to improve the access to quality childcare for low-income families so parents can work or attend a job training or educational program. The American Rescue Plan Act of 2021, the ARP, appropriated $39 billion in child care stabilization grants and supplemental discretionary CCDF funds to be used to respond to the COVID-19 pandemic. These funds provided states, territories, and tribes with additional program flexibilities, but were also subject to different restrictions than states' annual CCDF funding. According to HHS's Administration for Children and Families, the ACF, this funding served more than 200,000 child care providers and benefited as many as 9.5 million children. The OIG will determine how states use these funds, identify any risk areas, and review ACF's oversight of ARP child care stabilization funds. In a separate series of audits, the OIG will also determine whether selected states used ARP child care stabilization and supplemental CCDF discretionary funds in accordance with federal and any applicable state requirements. This final report is expected in fiscal year 2024. Now, the third OIG Work Plan update for May 2023 is titled Foreign Assistance to Combat HIV, AIDS, Tuberculosis, and Malaria Inspectors General Coordinated PEPFAR Oversight Plan for fiscal year 2024. Now, this report is expected to be coming from the Office of Audit Services. The U.S. government provides foreign assistance to fight HIV, AIDS, tuberculosis, and malaria, 3 of the world's deadliest infectious diseases, in order to help stem human suffering, economic loss, and political instability in developing countries. In 2003, President George W. Bush established the President's Emergency Plan for AIDS Relief, also called PEPFAR. And Congress passed the United States Leadership Against HIV/AIDS, Tuberculosis, and Malaria Act, hereforth called the Act. The Act established the Office of the U.S. Global AIDS Coordinator and Health Diplomacy, the OGAC, at the Department of State and gave the OGAC primary responsibility for coordinating all resources and international activities of the U.S. government for combating the HIV/AIDS pandemic. The OGAC allocates funds to PEPFAR implementing agencies, particularly HHS's Centers for Disease Control and Prevention, that's our CDC, as well as the U.S. Agency for International Development, the USAID. Now, the CDC and USAID, in turn, provide funds for HIV treatment, care, and prevention activities through grants, cooperative agreements, and contracts with selected implementing partners such as a U.S.-based and international non-governmental organizations and partner country governmental entities. The inspectors general of the implementing agencies are required to coordinate their activities and jointly develop coordinated annual plans for oversight to avoid duplication and maximize efficiency. This plan includes OIG's planned work related to the CDC's oversight and recipients' use of PEPFAR funding. This final report is expected in fiscal year 2023. Now, the fourth OIG Work Plan update for May 2023 is titled Nursing Home Facility Initiated Discharges, a Data Brief. This report is expected to be coming from the Office of Evaluation and Inspections. A facility-initiated transfer or discharge of a resident from a nursing home can be an unsafe and traumatic experience for the resident, as well as the resident's family. To address these concerns, Congress passed the Nursing Home Reform Act of 1987 to protect residents against inappropriate facility-initiated transfers and discharges. However, data from the National Ombudsman Reporting System show that from 2011 through 2016, the Long-Term Care Ombudsman Program, established by the Older Americans Act of 1965 to advocate on behalf of older Americans, cited complaints related to discharge or eviction more frequently than any other concern. In addition, the media has highlighted a rise in nursing home evictions. The OIG have ongoing work examining the extent to which nursing homes meet CMS requirements for facility-initiated discharges. In this data brief, the OIG will describe the sample of facility-initiated discharges they identified and examined in the ongoing work. This final report is expected in fiscal year 2023. The fifth OIG Work Plan update for May 2023 is titled Hospital Identification of Patient Harm Events. Now, this report is expected to be coming from the Office of Evaluation and Inspections. Hospitals collect information about patient harm events to meet Medicare requirements to measure, analyze, and track adverse patient harm events. Incident reporting systems enable providers and hospital staff to report information about patient safety incidents when they occur. In addition to general incident reporting systems, hospitals use other surveillance systems to capture events within specific hospital departments, such as the hospital pharmacy, or to capture specific types of adverse events, such as infections. Hospitals analyze this information to identify trends and root causes of safety issues to improve care and prevent recurrences of harm events. The OIG will determine the extent to which hospitals identify patient harm events and report those events to external entities. The OIG will use harm events the OIG identified through medical review for the study titled Adverse Events in Hospitals, a quarter of Medicare patients experienced harm in October 2018, as the basis for this review. This final report is expected in fiscal year 2024. And the sixth and final OIG Work Plan update for May 2023 is titled Opioid Use in Medicare Part D in 2022, Annual Review. Now, this report is expected to be coming from the Office of Evaluation and Inspections. The opioid crisis remains a public health emergency. In 2021, an estimated 82,310 opioid-related overdose deaths occurred in the United States. Identifying patients who are at risk for overdose or abuse is key to addressing this crisis. This data brief, titled Opioid Use in Medicare Part D in 2022 Annual Review, builds on the OIG's series of annual reports and provides information on opioid utilization among people enrolled in Medicare Part D in 2022. It provides 2022 data on the number of enrollees who received extreme amounts of opioids through Part D and those who appeared to be doctor shopping. It also identifies prescribers who ordered opioids for large numbers of these enrollees. In addition, the brief provides data on the number of enrollees who received drugs to treat opioid use disorder, the number of enrollees who experienced an opioid overdose, as well as the number of enrollees who received opioid overdose reversal drugs. This final report is expected in fiscal year 2023. And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to share some big tips on the facts that starting July 1, 2023, Part B, coinsurance for a month's supply of insulin used in an insulin pump that's covered under the DME benefit cannot exceed $35. That's really, really great news, right? Finally, a cap on costs to the consumer, to the patient with diabetes who requires insulin. So CMS will adjust payments to suppliers and pharmacies to account for the balance of the reduced coinsurance. Suppliers will continue to get the Medicare payment amount for the insulin, which is the average sales price plus 6% minus any applicable coinsurance, which again is capped at $35 for a month's supply. And remember, do not bill for supplies of insulin for July 2023 or subsequent months before July 2023, because CMS will complete the system's updates that are needed to make sure patients are not charged more than the $35 maximum allowed for the month of July. Now, your DME MAC, your Durable Medical Equipment Medicare Administrative Contractor, will also provide you with information and education about billing. What should you be doing for the months of May through June, right? That transition period. So wait for those details to come to you. Now, CMS has added 2 brand new modifiers to the April 2023 HCPCS quarterly update file. Those 2 new modifiers are JK and JL. That's J as in Juliet, K as in Kilo, J as in Juliet, L as in Lima. So the modifier JK is for a 1-month supply or less of a drug or biological. And of course, that drug or biological is insulin. And then the modifier JL, again, that's J as in Juliet, L as in Lima, is for a 3-month supply of a drug or biological. And again, that drug or biological is for insulin. So be mindful and inform your billing and coding teams to go ahead and bill a 1-month or 3-month supply with HCPCS codes J as in Juliet 1817, as well as a new HCPCS code J as in Juliet 1811, which is for insulin, specifically for FIASP, for administration through DME, which is that insulin pump, for 50 units. As well as another new HCPCS code, J as in Juliet 1813, which is for insulin, specifically Lyumjev, for administration through DME. Again, it's through that insulin pump per 50 units. And these are only for claims starting in July 2023 and later. And finally, I focus Season 9 Spark on success. I want this 9th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for success in all we strive to do. So, in this week's inspiring quote in Spark is from Salvador Dalí. Have no fear of perfection. You will never reach it. Absolutely true, right? I think this is an amazing quote that reminds us that the road to success is never, will never be perfect. I think this quote inspires us to keep working, knowing the road will be bumpy. This quote inspires us to change our mindset from the traditional way of thinking. We need to embrace the facts that success does not mean perfection. This quote reminds us that our journeys, our individual paths we take are marked with imperfections. It is with those imperfections that we are made stronger and more resilient and more courageous. I'm happy Salvador Dalí's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. So in my final note today, I really hope everyone's having a great start to summer, because today, June 21st, marks the first day of summer. So I really do hope you guys have mapped out your road trips for the summer, your picnics are lined up on weekends, and you're heading to music festivals at some point or the other during the months of June, July, and August. I know I am. So anyways, you guys, I wish you all an amazing, amazing week ahead. And remember, please keep carving time out for yourselves each and every day to keep an eye out on your mental health. Because remember, you need to decompress to avoid burnout. Thank you guys so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.